Good morning, Chairman. We are ready to begin.
Good morning, Denise. If you'll conduct the roll call, please.
Yes, Chairman. I'll begin with Roger Folsom,
Here.
Tommy Hopkins,
Here.
Kathleen Ruth, Norm Boyd,
Here.
David Cruz,
Here.
Shane Mobley,
Here.
Cynthia Rucker,
Here.
Anthony Williamson,
Here.
Robert Coles.
Here.
Chairman, that concludes my roll call.
Thank you, Denise, and good morning, everyone. We have a quorum, so we call the meeting to order. And as all of you realize, the objective for the second meeting in August is for budget approval. We do have one item to consider for initial adoption on the agenda today also. So with that, we'll start into our agenda, and Commissioner Burke, we'll ask you for any report you'd like to present.
Thank you, Mr. Chairman, members of the board, my DCH staff, and all the Georgians that may be joining us by Zoom. As the chairman mentioned, this meeting is to discuss the budget proposal for the next fiscal year and also to move along one of our waivers that are very important to many people in Georgia. Since our last meeting, I wanted to give a couple of updates. The SHBP team hosted a very successful BenPro conference. For those of you that don't know, that is a conference that they host for the benefits professionals, hence BenPro. It took me a while to figure out where that came from, but I finally landed on that. And this was focused on the mental health, and I very appreciate the fact that they have chosen that item for the last several years to be focused on at that conference, because it is such a challenging issue across the state. When I was in my medical practice, it's obvious that especially in rural Georgia, there's a lot of unmet needs in that area, and helping to educate our state employees and the benefits professionals on what their options are for state employees to receive the care that they need is extremely important. And I want to thank them. Putting on a conference away from the home office is always a big challenge, and having been there myself, as usual, it was done in a very professional manner. The other thing I want to update you on very briefly is just the rural transformation grants that were part of the Reconciliation Act passed by Congress earlier this summer. As most of you know, that comes with a significant funding for the state of Georgia, a minimum of $100 million per year for rural Georgia healthcare delivery for 5 years, and then some other money that we have to compete for, but I'm confident that we will put together a package that will be seen very favorably by CMS when they review it. We've had 3 in-person town halls. We had one at our State Office of Rural Health in Cordele. We had one in North Georgia, Jasper, and one in Vidalia. And we also had an online virtual town hall as well to get input from our stakeholders. We've had a portal open for the last month for all the stakeholders to let us know what their suggestions are for how we can make the best use of that financing, and we will be evaluating all these great ideas and coming up with a plan sometime in the next few months. I know this has been a busy summer for the board. I appreciate all the work you've done to help us to do these critical healthcare issues in Georgia. So thanks, Mr. Chairman, and I'll hand it back to you.
Thank you, Commissioner Burke. We'll move into our agenda with amended fiscal year 26 and FY 27 budget from Cody Whitlock, our CFO. Cody.
Good morning,
Commissioner, Chairman, members of the board. My name is Cody Whitlock, and I'm the Chief Financial Officer of the agency. Today, I will be presenting the amended fiscal year 2026 and fiscal year 2027 budget requests. Per the governor's budget instructions, DCH is maintaining its operational budget. The only requested increase is specific to Medicaid benefits. To level set before discussing the request, this slide shows the FY25 total expense by program and shows the breakdown of those expenditures. Approximately 97% of the total expense is related to benefits, with the remaining 3% to operate our administrative functions, the State Office of Rural Health, boards of pharmacy and dentistry, and our Healthcare Facilities Regulation Division. The next slide breaks down departmental administration. Most expenses are associated with contracts. The majority of those contracts are specific to the administration of our Medicaid benefits program, claims provider, auditing services, actuarial services, et cetera, and other related contracts. Approximately 9% is related to payroll, and you can see the rest of regular operating expenses, IT expenses, real estate, et cetera. Moving to SFY 2026, this shows our current base budget. This continues to show the majority of the funding within the Medicaid benefits program. You can see that on the pie chart with a total state funds budget of approximately $5.5 billion. With most of the funding being in benefits, we did want to highlight the beneficiaries DCH serves. The majority of the population in the green is our low-income Medicaid program. The majority of that population, as you can see to the right, is children and pregnant women. Although the population is the majority, if you can go back one slide, with the population being majority limb, our expense actually is primarily driven by our age, blind, and disabled program, kind of in the darker blue, and that's just due to the acute nature of that population and the expense associated with them. With an understanding of the population served, we also project our enrollment trend for the projections. As you can see in the chart, we project approximately a 2 to 3% increase year over year. This aligns with the month-to-month trend on pre-public health emergency growth. It's about an average of 0.17% per month. I do want to caveat, while the trend of enrollment is going up, our updated enrollment figures, which you'll see in amended 26, is lower than our base 26. So we assumed a little bit higher enrollment in base 26. We have since updated that for AFY 27. So enrollment is still increasing, but we will see a decrease in the amount needed just because it wasn't increasing at the rate that we initially thought we were in base 26. So moving into the actual recommendations to put before the board, it's within our 3 programs: age, blind, and disabled, low-income Medicaid, and Peach Care. We're requesting your bottom line numbers, $187 million in AFY 26. This growth is driven primarily by utilization with that 1 to 2% increase in enrollment. We have some annual adjustments with the nursing home Medicaid clawback and our Medicare clawback Part D and MedBuy, which is Medicare Part D, the last 2 of which are part of your dual eligibles Medicare enrollees. We also have a high-cost pharmacy trend with a slight reduction. The base 26 budget attributed $36.5 million in state funds for these high-cost drugs. The amended 26 projects a need of approximately 25, so the reduction is that $11 million from the base budget. I do want to highlight on the pharmacy trend, This is not an all-inclusive line for high-cost drugs. Rather, this is a carve-out for specific drugs. These are some gene therapy drugs for sickle cell and hemophilia that are a very high cost. So we did want to highlight those specific ones. Other pharmaceutical costs are in the preliminary growth line under category of service 300 when we're looking at the projections. Within LIM, as I discussed on the previous slide, we have a reduction which is driven by lower enrollment compared to base 26. Actual enrollment came in a little bit less than initially projected. And in Peach Care for kids, again, it's an adjustment to enrollment coming in then slightly different than initially projected. Moving on to SFY 27, the projection maintains the similar trends from amended 26 with an additional line related to the annual FMAP adjustment. Again, we're seeing growth driven by higher utilization, the high-cost drugs, and enrollment trends. We also have the nursing home increase, which is just an annual increase that was initially put in the budget in SFY 22, I believe, to go to the most recent audited cost reports. The next slide just shows kind of the breakout of some of those high-cost drugs that I was articulating earlier to get a general sense of the projection of what we're seeing and the difference between the two and as it relates to the overall budget trend. And those are our projections. I'm happy to answer any questions.
Anyone have questions for Cody? Hearing none, Cody, that was an excellent presentation.
Thank you very much.
Okay, we will need a motion to approve this budget. So we'll entertain that at this point.
Shane Mobley motions.
Shane Mobley has made a motion for approval. Is there a second?
Second.
Dr. Bob Coles has seconded the motion. Any further discussion or comments? Hearing none, all those in favor of the motion signify by aye. Any opposed, no. Anyone abstaining? Motion carries unanimously. Thank you, Cody, for your presentation. Let's move on down the agenda now to medical assistance plans as a waiver renewal, comprehensive support waiver program. And Lynette Rhodes, our Chief Health Policy Officer, will present to us. And Lynette, before you begin, I want to recognize you for your recent honor from the Atlanta Business Chronicle, recognized as a woman of influence. We didn't really need them to tell us that, though.
Thank you, sir.
Congratulations, and
Thank you very
thank you
much.
for all
I'm
you do.
truly honored and still surprised. So thank you. Thank you. So good morning, Chairman Folsom, Commissioner Burke, and members of the board. As always, thank you for the opportunity to present. This morning, I am presenting the department's proposal to renew the Comprehensive Supports Waiver Program, also referred to as the COMP waiver. This is in partnership with the Georgia Department of Behavioral Health and Developmental Disabilities. I am pleased to announce that I am supported this morning by Ashley Caseman. Ms. Caseman serves as the Director of the Office of Medicaid Coordination and Health Systems Innovation. We are requesting initial adoption of this renewal effective April 1st, 2026, pending final board approval and approval by the Centers for Medicare and Medicaid Services. The Comprehensive Supports Waiver is a Medicaid home and community-based services waiver operated by the Georgia Department of Behavioral Health and Developmental Disabilities under the authority of Section 1915C of the Social Security Act. Federal regulations require that all 1915C waivers be reauthorized by the Centers for Medicare and Medicaid Services at least every 5 years. The current comprehensive supports waiver is set to expire on March the 31st of 2026. As background, the comprehensive supports waiver serves individuals with intellectual and developmental disabilities who require intensive and comprehensive supports to live safely in the community. These individuals would otherwise require institutional care in settings such as intermediate care facilities for individuals with intellectual disabilities, nursing facilities, or state hospitals. The waiver provides services for those transitioning from institutional settings, as well as those at risk of institutionalization, by offering individualized, flexible supports that promote independent, community-based living. The waivers cover a broad range of services, including residential care, in-home supports, skilled nursing, behavioral services, community integration supports, and certain goods and services that are generally not available through the Medicaid state plan or beyond state plan limits. As part of this renewal, the department proposes the following updates. The first update is as follows. We will define limits for several services. Specifically, the department will define limits solely in units rather than in both units and dollars to simplify administration. This change does not alter any service provisions, eligibility, or limits. This change will impact services such as community living support, both basic and extended, pre-vocational services, intensive support coordination, financial support services, and community residential alternative. Again, it is important to note that this change will not alter any service provisions, eligibility, or limits. Second, we propose to consolidate the additional staffing, basic and additional staffing, and enhanced service definitions into one single additional staffing service with two separate rates, maintaining the same service scope and eligibility criteria. And third, we will update utilization and spending estimates for the next 5-year waiver period, beginning April 1st of 2026 through March 31st of 2031. These proposed revisions just described do not require changes to current policy or practice. The estimated cost impact for the 5-year period is as follows. For year one, the state share represents $386.3 million. The federal share represents $763.4 million, for a total projected fiscal impact for year one of $1.1 billion. For year two, the state share represents $402.3 million. The federal share represents $791 million, for a total projected fiscal impact for year two of $1.2 billion. For year three, the state share represents $419 million. The federal share represents $828 million, for a total projected fiscal impact for year three of $1.2 billion. For year four, the state share represents $436.4 million. The federal share represents $862.4 million, for a total projected impact for fiscal year four at $1.3 billion. And then finally, for year five, the state share represents $454.5 million. The federal share represents $898.2 million, for a total projected fiscal impact for year five of $1.3 billion. Over the 5-year waiver period, the projected total expenditure is approximately $6.2 billion, with the state share of $2.1 billion and a federal share of approximately $4.1 billion. An opportunity for public comment will be held on September the 3rd at 11 a.m. via Zoom. Written comments are due on or before October the 3rd. A copy of the waiver application and public notice will be available on the DCH website. I will pause now for any questions from the board.
Any questions for Lynette? Lynette, obviously you did a good job describing all those large numbers, so here are no questions. Is there a motion for initial adoption?
Blue.
I heard several, so I think we have a motion for initial adoption. Is there a second?
Second, Cynthia.
Okay, we have a second from Cynthia Rucker. Any further discussions or comments? All those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries unanimously. Thank you, Lynette, for the presentation.
Thank you.
We've covered our agenda items. Is there any new business that needs to come before the board that anyone's aware of? But hearing none, wish all of you a happy and safe Labor Day holiday, a long weekend. I'm excited for the full start of college football, so I know some of you are as well. So enjoy yourself with family and friends, and our next meeting will be September the 11th, and thank you for your attention today. We stand adjourned.
Thank you, Mr. Chairman.
Thank you.